Hi everyone, my name is Daniel Thomas Ringo with the lesson number 045 and I'm going to explain the background of our research. An arrhythmia is an irregular rhythm of the heart. Several methods known to be able to control the heart rate in arrhythmias that result in improvement of the heart function. However, if it's left untreated, it can result to several complications. The complication of heart arrhythmias in general may include stroke, heart failure, and the worst complication is sudden cardiac death. Although in general, the mortality rate of coronary artery disease is lowering, the survival rate from sudden cardiac death remain low, with the survival rate below 10%. Judging from how this disease has very low survival rate, we decided to do our research to enhance our knowledge regarding the disease. These are the problem of our research. The first one is what is the definition of arrhythmias, what is the epidemiology of arrhythmias, what is the etiology of arrhythmias, how is the pathophysiology of arrhythmias, how to diagnose arrhythmias, what is the management of arrhythmias, and the last will be what is the prevention of arrhythmias.
My name is Pierre Joshua. I study number 077. So, the objective of this research is to understand what arrhythmia is, to understand the epidemiology of arrhythmia, to understand the etiology of arrhythmia, to understand the pathophysiology of arrhythmia, to understand how to diagnose arrhythmia, to understand the management of arrhythmia, and to understand the prevention of arrhythmia. Next, the benefit of this research for public, so public can get new knowledge regarding arrhythmia. Medical community can further understand about the pathophysiology, diagnosis, differential diagnosis, and management of arrhythmia. And for the author can enhance their knowledge about arrhythmia.
Hello, my name is Putra Elandari and I'm number 11. So today I will present about the definitions. Cardiac rhythm disorders, which are one of the most important epidemiological and public health problems, are cardiac arrhythmias. Congenital arrhythmias are one of the leading causes of sudden cardiac death in young people and more common in Asia, and result from the genetic disorders caused by mutations in genes encoding cardiac ion channels and lead to electrophysiological characteristics that often occur in the absence of structural abnormalities. Cardiac arrhythmias are said to have a significant relationship with an increased risk of cardiovascular complications and sudden death. Next, sudden cardiac death occurs when the interactions between the susceptible substrate and the trigger acutely produces sustained ventricular tachycardia that progresses into ventricular fibrillations. And ventricular fibrillation is the most common life-threatening arrhythmia, and atrial fibrillation is the most common ongoing arrhythmia and increases with age. Sudden cardiac death due to arrhythmia is primarily due to disturbances in intracellular calcium 2 plus homeostasis, wherein the mechanism of spontaneous calcium 2 plus release from the sarcoplasmic reticulum can trigger fatal arrhythmia.
Hello, my name is Mani and the last 3 digit of my name is 249. Today I'll be talking about the epidemiology of cardiac arrhythmia. Cardiac arrhythmia are cardiac rhythm disorders that compromise an important epidemiological and public health problem. Cardiac arrhythmias are significantly associated with increased risk of cardiovascular complications and sudden death, consequently leading to decreased quality of life, disability, high mortality, and healthcare expenses. AF is atrial fibrillation is the most common sustained arrhythmia and has been further increasing with the aging of society. Asians than in Westerners, the prognostic impact on stroke and mortality in Asians are comparable. Sudden cardiac death occurs in approximately 50,000 to 100,000 cases per annually in each country in Asia. Thank you. That's all from me.
Hello, Dr. Friends. My name is Vinny Fernand Valentin with the number 086. Arrhythmia continue to be a leading cause of sudden cardiac death, so understanding their cause and high-risk characteristics is critical. Sudden cardiac death is thought to result from the interaction of a vulnerable myocardial substrate caused by underlying disease process and an acute trigger. When vulnerable substrate and an acute trigger interact, the result is sustained ventricular tachycardia that progress to ventricular fibrillation. Not all ventricular arrhythmia result in sudden cardiac death. These are the three most common causes of sudden cardiac death related with arrhythmia. The number one is ischemic cardiomyopathy. In ischemic heart disease, ventricular arrhythmia caused by an acute myocardial ischemic and scar-related ventricular tachycardia caused by a previous myocardial infarction are the two main mechanisms of sudden cardiac death. Number two is non-ischemic cardiomyopathy. The same or different type and morphologies of ventricular tachycardia can occur in the same patient due to a different cause of non-ischemic myopathy. And the last one is hypertrophic cardiomyopathy. The arrhythmia associated with sudden cardiac death in this population are rapid monomorphic ventricular tachycardia and ventricular fibrillation. Thank you.
Hello everyone, my name is Putri Dewi with student number 028. I will explain about the pathophysiology of arrhythmia in sudden cardiac death. Sudden cardiac death from arrhythmia is mostly generated from ventricular tachycardia. This condition will manifest into ventricular fibrillation and finally asystole. In post-myocardial infarction, the remaining survived myocytes yield an electrical remodeling that results in anisotropic conduction of the cardiomyocytes. This electrical heterogeneity forms localized slow conduction regions that are the main reasons of arrhythmogenesis. The autonomic nervous system also role in this phenomenon. The system influences the autonomic dysregulation that becomes the main reason for ventricular arrhythmias in sudden cardiac death. For patients with advanced heart disease, sudden cardiac death may be generated from a bradyarrhythmia. Some underlying conditions like hypertrophic cardiomyopathy, dilated cardiomyopathy, the chronic scar from myocardial infarction, and acute plaque destabilization have a higher risk to experience sudden cardiac death from arrhythmias. The ventricular tachycardia may be triggered by transient ischemia, hemodynamic fluctuation, neurocardiovascular influences, and environmental factors.
Hello, my name is Jonathan with student number 137. So the clinical manifestation of arrhythmias for some patients may be asymptomatic, but others most commonly may include chest palpitations, a racing heart rate, slow heart rate, chest pain, shortness of breath, also anxiety, fatigue, lightheadedness, dizziness, sweating, and syncope. Patients may present with stroke or cardiovascular collapse. The symptoms are non-specific with the result that cannot be used to diagnose and establish the onset of arrhythmia. In establishing the diagnosis of arrhythmia, the things that need to be considered are knowing the clinical consequences, knowing the underlying disease, and reading the ECG as examinations quickly and accurately.
Hello, my name is Chakodesi Intandalam Scotty with 3-digit of student number 231, and I'm going to continue about the diagnosis. So other than knowing clinical manifestations of arrhythmias, clinical consequences, underlying disease, as a general practitioners, we need to know some ECG characteristic of each type of arrhythmias. In other words, we need to read ECG quickly and accurately, as my friend has said before. So some tests that may be done to confirm the presence of irregular heart rhythm. The first one is tachycardia. It will represent heart rate greater than 140 until 250 beats per minute. Bradycardia, it will represent heart rate lesser than 100 beats per minute. Atrial fibrillation, it will represent irregular ventricular response with heart rate 400 until 700 beats per minute. And atrial flutter with ventricular rate lesser than 300 beats per minute and has a sawtooth appearance on the P wave. And ventricular fibrillation, it will represent irregular heart rhythm with 350 until 450 beats per minute. In addition, it also can be used echocardiogram, cardiac catheterization to determine if the cause of the arrhythmia is coronary artery disease, and also electrophysiology study or EPS. Next.
Good morning, Doctor and friends. My name is Sharon Praista with student number 051. Now I'll continue the presentation about the management. First of all, we see from the pharmacological aspect. We know that some heart problems can occur if the internal electrical system is damaged, and this condition is sometimes closely related to other heart problems such as arrhythmias. And if it's not treated promptly, cardiac arrest can lead to death or disability. So the use of medication is essential in some patients to control arrhythmias and improve symptoms, which can be categorized by the Vaughan-Williams 4-level classification. First is sodium channel blockade. So some that have been used to treat VT or SCA include intravenous lidocaine, oral mexiletine, quinidine, and flecainide. Second one is beta blockers, which the efficacy is related to reduce sympathetic activity to the heart, so slowing of the sinus rate. Third are amiodarone and sotalol. Amiodarone has a wide spectrum of actions or known to be a multi-channel blocker, which help to reduce the risk of SGD and all-cause mortality. On the other hand, sotalol appears to reduce the defibrillation threshold. And last but not least, calcium channel blocker. For patients with a structurally normal heart, verapamil or diltiazem can suppress some outflow tract origin. However, for patients with prior myocardial infarct, intravenous verapamil given for sustained VT has been associated with hemodynamic collapse. That's all from me. Next will be presented by my friend. Thank you.
Good morning, doctor and friends. My name is Putri Tamelis Lenti with name 081. Besides the pharmacological treatment, there is also a non-pharmacological management that is highly effective in terminating life-threatening ventricular arrhythmia, which is known as defibrillation. This procedure uses an electric shock that is delivered to the heart and will then temporarily stop the irregular heart rhythm. With this, the heart will return to its normal rhythm. This therapy can be delivered as a transvenous ICD, a subcutaneous implantable cardioverter defibrillation, a wearable cardioverter defibrillation, or an external defibrillation. This device monitors the heart rhythm continuously and delivers therapy in response to a tachycardia that meets pre-programmed detection rates and arrhythmia duration. Further management can also be done, such as coronary angioplasty, which is a procedure used to widen, block, or narrow coronary arteries by using a balloon-tip catheter into a vein and possibly placing a stent, and also other operations such as heart bypass surgery, cardiac catheter ablation, and corrective surgery to restore normal blood flow and heart rhythm.
Hello, my name is Christian Rawan, student number 040. So let's talk about prevention. Preventing arrhythmia can be done by changing a healthy lifestyle, starting from eat healthy diet, do exercise regularly, stop smoking, maintain a healthy weight, do regular checkup to check blood pressure and cholesterol, and managing stress. A patient with arrhythmia should identify any factors that increase the risk of sudden cardiac death. This factor can include arrhythmia with a type of ventricular tachycardia or ventricular fibrillation, a family history with sudden cardiac death, obesity, diabetes, and many more. Then consult to a doctor, perform routine follow-up, change lifestyles, and take medications such as ACE inhibitors, beta blockers, calcium channel blockers, and other antiarrhythmic drugs. In case of life-threatening ventricular arrhythmia, the use of defibrillators is very effective in preventing sudden cardiac death. Thank you.
My name is Iputeka Dharma Putra with name 024. Conclusion. Arrhythmia is an irregular rhythm of the heart and can be categorized into two types, tachycardia and bradycardia. Arrhythmia may be caused by electrical heterogeneity and autonomic dysregulation. Sudden cardiac death in arrhythmia mainly generated from ventricular tachycardia and in some cases bradyarrhythmia in patients with advanced heart disease. Clinical manifestation of arrhythmia is non-specific and diagnosis is based on electrocardiogram, echocardiogram, and cardiac catheterization. Management can be done pharmacologically by antiarrhythmic medication and non-pharmacologically by defibrillation. Prevention of arrhythmia, including change of lifestyle, medication, and use of defibrillator.